So welcome, Tanya.
Thank you for the introduction. It's really an honor to be here today to talk to you about VR options for acute and chronic pain. I'm just going to be talking a little bit about pain and touch upon the advances in virtual reality therapy, and then touch upon the emerging trends as well as the underlying theory. So I want to begin with, what is the cost of pain? So while pain is a nearly universal phenomenon, the cost of pain can be very personal. It can span anything from trauma and painful experiences to debilitating chronic illness that can really rob people of the fundamental joys of life, such as interacting with loved ones. And this affects many people. Chronic pain alone affects over 50 million people in the US. And this costs us as a society up to over $500 billion annually. The management of pain still remains complex and relies upon the use of opioids, which has a number of side effects and drawbacks, including respiratory, depression, and possible death. It can make pain worse, and it can also lead to addiction and what we now know is an opioid crisis. Next slide, please. So looking at the opioid crisis in the US, unfortunately, we can see that the US is really leading the world in having the highest proportion of drug-related deaths internationally. And this began in the 1990s with overprescription of opioids for pain relief. About 20 years later, we began to see an increase in heroin-related deaths. And looking back, it's not surprising because 80% of heroin users report first misusing prescription opioids. As we've come out with stronger opioids such as fentanyl, we've seen an increased rise in the deaths related to synthetic opioid use. And this has increased over 4,000 times since 1999. And so we can definitely see that this is an unsustainable situation. Next slide, please. So this is where VR really shows a lot of promise. It's really captivated the interest of the medical community. We performed a review of the PubMed database and found over 600 published articles there. And a large portion of that focuses on clinical outcomes, such as RCTs and clinical trials. Other studies have found even more evidence. Over numerous databases, there are upwards of 11,000 studies or more. And these studies have been predominantly positive, with the majority showing that VR works and that there are few to no side effects. Next slide, please. So looking at the studies, there's a really wide range of options for VR. VR can be passive, it can be active, it can be non-immersive, or it can be fully immersive. There's a variety of content as well. We can look at natural landscapes or play dodgeball during physical therapy. Now, the duration of the sessions range anywhere between 5 minutes or less to 30 minutes or more. So it is a really, really flexible and adaptive technology that can be used across a wide range of conditions. Next slide, please. So this is a word cloud, which shows the frequency of conditions in which VR has been studied. And it's taken from 79 completed clinical trials registered at clinicaltrials.gov. The bigger the words, the higher the frequency. So we see that VR has frequently been studied in burn pain, anxiety, in chronic pain and acute pain, but that there's a really big spread of conditions from anywhere from heart failure to labor pains to chronic lower back pain and joint pain. Next slide, please. So looking at the clinical data visualization, so I have a video here that hopefully plays. So if we could just look at this video really quick. Okay, this is the clinical augmented reality and artificial intelligence network framework being developed at the University of Michigan. It uses real-time neurological data to help us visualize pain in the clinical setting. So it's in its initial stages, but it can detect and localize or tell where the pain is. And as this continues to develop, the researchers hope that they can start including pain severity as well as pre-pain cues like anxiety or expectation. Okay, so can we go back to the slide really quickly? Okay, and so as we see, there's a progression in data visualization. Originally, before technology really started to grow, we saw subjective surveys that's still widely used today. Over time, we started to use more two-dimensional technology, such as MRIs and fMRIs, and that's really improved our visualization of pain. So this natural progression to three-dimensional space and real-time data really stands to improve patient outcomes for people, especially those, for instance, who can't speak, people who've had strokes or who are otherwise incapacitated. And we can help ensure that they are not in pain. Next slide, please. So the results of the data analysis really show that there's a significant advantage to be had through the use of VR analgesia. As we have seen from many of the other speakers, the effects stand to be better than morphine in some situations. It has a significant number of other advantages, such as significant reduction in chronic pain, as well as lasting effects, even after just a 5-minute session. Some other advantages include reduced use of opioids, and there are also behavioral advantages like decreased fear of movement during painful physiotherapy. And in the end, people really like VR. There's a high patient satisfaction, which is a real win for medical compliance. Next slide, please. So how does VR achieve pain relief? Well, we know a lot about the structure of the brain and the different circuitry that controls pain. And we can use VR to tap into this circuitry by changing cognitive cues, emotional cues, sensory cues. And then that can change our perception of pain, of the way that we respond to pain, as well as our long-term stress management skills. Essentially, VR can augment the natural ability of the body to control its pain. And these techniques that we're implementing are based off of established effective pain management techniques that have been developed for decades. Next slide, please. So the particular advantage of VR is there are many factors that make it effective, one of which includes sensory immersion. We find that the more immersive the VR experience, the more pain reduction is seen. Almost twice as much clinically meaningful pain reduction. And as the technology improves, we have improved things like haptic feedback, which essentially would allow us to touch virtual reality. This combining with audio-visual cues can really increase the sense of immersion. Next slide, please. So other aspects of VR that are shown to be really positive are interactivity. So that can increase our sense of control of the painful situation and build on a sense of presence or the psychological illusion of really being there. And that, of course, is shown to decrease the pain that we can feel. Next slide, please. So how real can this actually get? Well, so this is actually a screenshot from Google VR showing Sedona, Arizona. It looks almost like a picture. So early developments in VR focused on environmental realism, and we've pretty much essentially mastered that. As VR develops over time, we start looking at things like virtual embodiment or ownership of the avatar body. And as that becomes more lifelike, like what you can see here, I use the app Spatial.io, which is a virtual conferencing app, to make this avatar, and it looks pretty realistic. Next slide, please. As this becomes more realistic, well, some people might wonder what's next, you know? So Riva and his colleagues in 2017 coined the concept of sonoception, which is a focus on the internal body environment, which is the feeling of being within the body. So he said that we may be able to use cues like heartbeats or our vestibular senses to increase the feeling of being within the body. Right now, we're pretty much at the virtual embodiment phase, which is just ownership of the body. Next slide, please. So what is virtual embodiment based on? So this is a really studied phenomenon. In the 1990s, there was a really famous experiment done called the rubber hand illusion that found that when participants were watching a rubber hand being stroked synchronously or at the same time with one's own unseen hand, it causes the rubber hand to be experienced as part of the body. And we can see that happening in the picture here. There's a rubber hand and the patient's real hands being stroked at the same time. This creates a sense of ownership of the limb. And so this highlights a very interesting part of the way that we see ourselves, the fact that our perception of ourselves is probabilistic. Next slide, please. And so the way that our body representation is modulated is through something called the body matrix. Now, this looks a little complicated, but essentially the brain creates a simulation of different possible realities of ourselves, and it uses our sensory data to decide what's really happening. And now that we know this, we can use things like VR to really target different aspects of what makes this body matrix work. So we can adjust things like visual cues to decrease the perceived swelling of an arm, for instance, and that has been shown to decrease pain. Other things that we can do is include a protection around a virtual arm, and that helps people feel less pain as well. So there's a lot of potential in the VR space to change the way that we manage pain. Next slide, please. So there are many emerging body swap. So there are many emerging virtual embodiment techniques, a couple of which that have been used in the psychological field include body swapping, which is the ability to swap avatars with somebody else and to change our perception of that group of people, say the very young or the very old. There's also another concept called mindful embodiment, which involves reference frame shifting or restructuring our own sense of body consciousness. And Osima and his colleagues use these two techniques in conjunction to allow patients to switch into an avatar of Freud and give themselves positive psychological advice. And they found that this does improve mood, which is, of course, an emotional aspect of the way that we see pain. So these kinds of concepts have been well studied in the psychological area in terms of eating disorders, obesity, and mood. And it's just an emerging interest in applications for pain. Next slide, please. What pain is really focusing on right now is augmented embodiment, which again is an extension of the rubber hand illusion. So as we saw before, we can synchronize our different senses, such as our sense of touch to our sense of vision, and have an ownership of a rubber hand. So in 2019, Suzuki et al. Showed that we can also do the same thing with with our heart pulsations. We can synchronize pulsations in the arm with pulsations in the heart and improve our sense of ownership of our virtual body. And this feeds into the idea of sonoception, again, introduced in 2017 by Riva. So this stands to really allow us to create a new technological paradigm that can tap into the potential of VR to use our sympathetics and parasympathetics aspects to treat pain. Next slide, please. So there's a really great potential for advancement in VR. Everything from standalone packaged home-based VR products at home to precision pain management in the clinical setting. Next slide, please. And I'm just going to begin wrapping up here with the summary of advantages of the VR analgesia option. So it's safe and it's easy to use. It's non-invasive and it's not pharmacological. It's shown to be effective with over a wide range of conditions, and the effectiveness does not appear to decrease with frequent use. It's trackable and it's evidence-based, and most importantly, it's customizable for patients' needs. Next slide, please. So are there any disadvantages? There are some. So we've seen reports of things like simulator sickness, which is something like a motion sickness. You can get a little bit of a nausea or vomiting, headaches, neck pain, and eye strain. There are some potential risks as well, such as risks of infections or mechanical hazards from just equipment itself. In terms of the use in the very young, you might see the development. There's a risk of development of myopia over time. We can also see problems with hearing if the audio is too loud. It can be contraindicated in people with epilepsy or who may be prone to seizure disorders. But what can we do about this? Next slide, please. What's really important to remember is that virtual reality is not exactly like a pill where you give it to someone and then you can't control the side effects. It's really important to remember that this is a crafted experience and a technology that continues to grow. So as we learn more about the technology, we may be able to even tap into our parasympathetics and sympathetic aspects of our body, which control many of these symptoms. So it's definitely much more controllable than the current alternative. So future areas of research should focus on mitigating risk. The more we learn about the ergonomics of the machine, we can really design a good best practice standards and achieve a better therapeutic effect in a safer way. Other areas that we might want to improve upon are learning more about the therapeutics and the risks, and seeing how augmented reality or mixed reality can really improve solutions in this area. So with increased knowledge, hopefully we'll be able to create safe, effective alternatives to improve patient care across a wide range of conditions. Hopefully we can reduce the unintended side effects of opioid use in pain management and really revolutionize pain management. Next slide, please. So that's all I have. Thank you for your time and attention. It's a really great experience to be here.